Welcome to Ignite and our session. I'm Jenn Roth, the Director of Global Healthcare Product Marketing. Today, we're going to share how to free up time and resources to focus on the things that matter and drive more value back to your organization using the Microsoft Cloud for Healthcare. Here's what you'll take away from today's session: how Microsoft and Nuance have the solutions to help solve your organization's biggest challenges, and how to leverage your organization's data to critically help improve patient care, health team efficacy, and organizational performance, and how Microsoft's robust partner ecosystem can help your organization build and extend Microsoft Cloud services. Let's get started. So we all know the COVID-19 pandemic was a catalyst for change, creating a shift of consumer preferences and a care delivery innovation across the healthcare ecosystem. And with more money to spend, a greater need for online access, and renewed focus on health and wellness, consumers have become more calculated about where they spend their money and the experiences that they expect from their healthcare provider. But certainly, clinician burnout and the Great Resignation are continuing to drive significant challenges and budget ramifications. Employee shortages have a ripple effect. Physicians may have to limit their time with patients. Shortages make it difficult for patients to get routine preventative care or even emergency care. And strained access to care exacerbates those health disparities among marginalized communities. And finally, those shortages make it even more difficult for your healthcare system to prepare for COVID-19 surges or future public health emergencies. The challenges that you see to unlock your business value within your own organization is likely what every organization is facing today. If you think about it, you probably have plenty of data, but you're underserved with insights from which you can make decisions and act. Silos of data and manual data collection really restrict your access to that important information, which can delay decisions and add cost, requiring teams of people to collect and collate data before it's even analyzed. Adding to that, all the requirements to keep it secure, private, and compliant are even more complex than ever before. So in order to drive that future transformation, organizations need to treat their data as a strategic business asset and really leverage it to unlock that long-term business value. We can all agree that we have witnessed 20 years of transformation distilled down into 2 years. And Microsoft is committed, and we have dedicated resources to empowering our customers to help meet some of the opportunities to impact large-scale change. Focusing on just a few of these areas can create a wide range of business impact across your organization. And with the Microsoft Cloud for Healthcare, we're trying to help you by providing trusted and integrated capabilities that make it easier for your organization to focus on what matters most: improving patient experiences, connecting those frontline workers to better enable collaboration, and unlock powerful clinical and operational insights. And together with Nuance, outcomes-based AI healthcare solutions, we are even better positioned to help your organization improve clinician experiences by reducing that time spent documenting patient encounters that help alleviate clinician burnout. And the capabilities of the Cloud for Healthcare are composable, meaning they can leverage and be deployed one at a time or in groups. And your organization can also leverage your existing investments in Microsoft Cloud technologies by applying these capabilities to solutions already deployed in your environment. Cloud for Healthcare is also built on that foundation of protecting health information, and it helps support your organization by augmenting the Microsoft Cloud with industry-relevant compliance, security, and interoperability standards. And again, the power and breadth of Nuance products brings us to offer even more robust AI-powered solutions built specifically for healthcare in mind. And it helps support organizations drive personal and accessible healthcare for their patients. And I would certainly be remiss if I didn't talk about the breadth and depth of our healthcare partner ecosystem. It continues to grow, and with Nuance, we now extend that ecosystem even further with leading EHR and diagnostic partners. Our partners continue to build and extend our core platforms and these healthcare capabilities so your organization can realize the benefits faster. The case for change has never been higher. And through Forrester Total Economic Impact Studies commissioned by Microsoft and countless customer testimonials, these highlight some of the business impacts that customers have realized across Microsoft and Nuance solutions. We are here to help your organization find more business value and cost-saving efficiencies just like these. Microsoft Cloud for Healthcare brings the power of industry-tailored capabilities and components built on the foundation of the Microsoft Cloud and extended by that robust partner ecosystem. All of this is built with that desired outcome of delivering better patient experiences, delivering better insights that drive positive change, and overall better care across the entire care journey. Now, let me turn it over to Umesh to share more on the latest updates from the Microsoft Cloud for Healthcare. Over to you, Umesh.
Thanks, Jen. Hi, everyone. I'm Umesh Rustogi, GM for Microsoft Cloud for Healthcare. Many of you have asked about how we design and build our industry clouds, particularly in a regulated industry like healthcare. Our pivot to industry is about building vertical capabilities across these horizontal platforms to ensure that our partners and customers have the comprehensive cloud platform they need and have a quicker time to value in their digital transformation journeys to achieve the desired business outcomes faster. It utilizes the familiar Microsoft horizontal technologies like Azure, Power Platform, Dynamics, Teams, etc., and augments them with industry-specific IP like connectors, APIs, data models, workflows, AI services, etc., etc. Each of these industry clouds brings together the breadth of our solutions along the new capabilities, customizations, security tools, and most importantly, compliance requirements that are specific for each industry and often different across regions. These industry clouds are also designed to work together as one, yet are modular enough to independently support different customer use cases. Our industry clouds also deliver new innovations, capabilities, and enhancements in a repeatable and predictable fashion as part of our biannual release waves. Let us now review some of the recent, new, and planned feature updates to Microsoft Cloud for Healthcare that can help healthcare organizations drive additional insights, new innovation, and better business outcomes. These updates span across the various functional scenarios that Jen had talked about, as well as the foundational data management and AI capabilities for healthcare. With the new data integration toolkit, we have now provided your IT admins and integration specialists with a single pane of capabilities and tools to set up, configure, and manage their data integration components. This will make it easier for them to enable health data exchange with your organization's existing IT landscape. These new enhancements include improved experiences navigating the tool, logging and error handling capabilities for easy troubleshooting during setup and configurations, as well as entity map validations, etc. Next, virtual health tables is an important capability used by organizations to set up FHIR resources as virtual entities in Dataverse by connecting to FHIR endpoints like Azure Health Data Services. This helps your organization avoid data duplication, reduce data storage cost, and with this release, we have now further expanded the list of resources which are enabled for virtual health tables and added new resources like allergy intolerance and episode care. I'm also excited to announce the full feature release of Dataverse healthcare APIs to support bidirectional integration capabilities of FHIR data. These APIs provide a new improved way to integrate and exchange FHIR data between Dataverse and other FHIR endpoints like Azure Health Data Services or potentially other EHRs. In this release, these APIs ship with out-of-box logic app templates to enable a scalable and automated workflow to connect to healthcare APIs. And these APIs enable not just ingestion, but also write back to a FHIR endpoint and provides improved logging and error handling capabilities that is actionable. Next, in this release, we continue to invest in healthcare industry data models. With Microsoft Cloud for Healthcare, we are now using FHIR R4-inspired data models to bring multiple systems and applications together by providing a shared data model for your applications. This simplifies data management and app development by unifying data into a common data model shape and applying consistency across multiple apps and deployments. This leads to faster innovation and easier data interoperability. This month, we are releasing an updated provider data model with an updated set of HL7 FHIR R4 entities commonly used by customers and partners to build or extend their own healthcare applications leveraging Microsoft Cloud for Healthcare. Later this year, we will release Microsoft's payer data model containing a set of HL7 FHIR R4 entities, and as well as data models for Microsoft Life Sciences customers as well. Organization today can spend a lot of time defining a harmonized and consistent schema for their enterprise data warehousing, clinical and operational analytics, as well as lakehouse initiatives. Our database templates in Azure Synapse are industry-specific data models that act as blueprints and enable organizations to quickly jumpstart their analytic-based industry use cases. Customers and partners can customize and extend these standard templates using the database editor in Azure Synapse. Our latest release includes templates for healthcare providers, payers, pharmaceuticals, clinical trial, retail pharmacy, and genomics use cases. Our next update is about unified patient view that provides patient insights and is at the center of many healthcare processes. Getting the full 360-degree view is essential for good quality care. Your care coordinators can now see relevant information faster through improved information architecture in the patient view. It also enables you to build your own end-to-end scenario, leveraging low-code, no-code Power Apps. This gives your organization the ability to create your own applications that meet your organization's own unique use cases and helps faster and better care management. The patient trend view feature, which we released in a preview, further extends the unified patient view. This patient indicator control provides computed measures and insights about a patient, for example, number of days since their last appointment or the number of hospitalizations in the last year. The specific measures to be used can be set up by your IT team during your specific deployment. Patient trends now also includes missed appointment prediction. Missed appointments can cost healthcare organizations significant waste of time and resources. Research has also shown that patients are significantly more likely to miss an appointment if they have had a missed appointment in the past. This latest feature enables organizations to use AI to assess the likelihood that a patient will miss their next appointment. It also provides users with an explanation of the factors that influence the prediction. Now your organization can use these predictions to improve its decision-making process and take proactive measures like care teams reaching out to the patient ahead of time to help ensure that patients will attend their next appointment and maintain continuity of care. Our next feature delivers improvements to care plans. Care plans are critical for healthcare organizations switching to value-based care to improve the quality as well as cost of care. With this new feature and improved usability, your care team users can now easily create and customize care plans to meet your existing workflow and easily view patients' goals, interactions, and activities throughout their care journey. Organizations that leverage our patient access solution can now enable patients to also access their personalized care plans through the patient portal, view updates, view any upcoming activities, and modify the status of any completed task. This helps to improve the patient experience as well as simplify their day-to-day activities. Patient journeys are everything that a patient must go through, from being introduced, admitted, cared for, discharged, and possibly repeating a cycle as a retained patient. Later this year, we will be releasing new productivity tools to help your organization automate workflows across care management and surface tasks and notifications to improve the quality of patient journey. This capability will help save valuable time and create even more efficiency for your care manager, as well as administrative users that interact with the patients. We have now enabled an even tighter integration between Patient Service Center and Microsoft Teams. Now your contact center agents and care managers have the flexibility to initiate a patient follow-up call directly from your Patient Service Center solution and coordinate with your patients via real-time audio calls and transcription. This improves appointment flow from your contact center to initiate follow-up calls with a patient, as well as part of your virtual care services. It is estimated that about 80% of healthcare data is unstructured, including clinical notes of diverse types, medical publications, health-related email communication, and much more. Text Analytics for Health is a generally available natural language processing service within Microsoft Azure Cognitive Services. This was purpose-built to extract structured health-related information from unstructured text in healthcare. Organizations have used this NLP service to enable various use cases like enriching their unstructured clinical notes for search and analytical purposes, or automating translation and routing of patient emails. In this recent release, Text Analytics for Health has been further extended to provide support for unstructured text in 6 additional languages, namely Spanish, German, Italian, French, Hebrew, and Portuguese. I hope you enjoyed the quick overview of some of these latest enhancements. Now let me turn it over to Lydia Williams to showcase Microsoft Cloud for Healthcare in action.
Hi, my name's Lydia Williams, and I'm a Principal Program Manager at Microsoft. Patients today are craving a relationship with their provider that makes them feel safe and understood, and providers are craving solutions that enable them to deliver proactive care at scale. I'm going to give you an overview of the Microsoft Cloud for Healthcare's patient engagement solution and show you how we're unlocking scenarios for providers that truly were not possible before. Mattia is an outreach specialist. The core part of her job is to ensure that patients are set up for success with their care. Today, she's looking at a dashboard with population health data coming from medical and non-medical systems. The dashboard includes AI predictions of the likelihood of patients missing upcoming appointments. These predictions were configured by analysts and customer insights. She notices a recent increase in missed appointments. Reducing missed appointments is a key priority for providers wanting to lower costs and improve patient outcomes. So naturally, Mattia wants to dig a little deeper. A recent survey showed her that patients who live far away from their health facility often miss appointments because of transportation issues. She knows that not being able to access great healthcare is a barrier for many patients and can be stressful. She decides to run a patient outreach campaign to let them know that there's an easier option: virtual appointments. Lack of access to transport is just one example of a social determinant of health. We've seen with many providers how bringing together different forms of social and medical data using our customer insight solution empowers them to massively improve patient outcomes. First, Mattia generates a list of the patients she wants to target and then creates the campaign. Our patient engagement solution has an extensive collection of commonly requested healthcare campaign templates. Using out-of-the-box flows and email templates makes it incredibly easy to create the campaign. Within minutes, her work is done. Olivia is part of the cohort who receives the outreach email. What a relief. She's had problems getting to appointments recently, and with several new health issues, she's been really worried about how to manage them. She had no idea that virtual appointments were an option. She follows the link to the patient access portal and schedules her virtual visit. This is a new experience for Olivia, so we want to make sure she feels supported. If at any point she struggles, the chatbot, supported by Nuance, would understand her intent and help her. The ability to support her in this way is unique. On the day of the appointment, she receives a reminder message via her preferred channel and follows the link to join the call. The appointment is provided using Teams and Teladoc and opens directly within the browser, with no need to download another unnecessary app on her phone. She waits for her doctor in a virtual waiting room. Dr. Lorenz jumps into Teladoc and sees it's time to meet with Olivia. Joining the appointment, she can both video chat with Olivia and easily review her rich medical record. Olivia shares several changes to her health, including her diabetic health and a new rash on her arm. During the call, Dr. Lorenz captures notes quickly through Teladoc in Teams and details her suggested steps. In future, this will also be supported by Nuance. Olivia's care manager sees Dr. Lorenz's notes and creates a care plan to better capture her suggestions. That afternoon, Olivia receives the new plan. In the coming weeks, she adds regular entries for each item. Unfortunately, after a couple of weeks, her care manager is notified that Olivia has slipped a little and is not tracking her blood glucose levels regularly. Concerned that Olivia's health will suffer, her care manager reaches out to Dr. Lorenz for guidance via Teams. Within minutes, she has a clear understanding about how to help get Olivia back on track. What we've just seen is a personalized and proactive end-to-end patient engagement journey. And with that, back to you, Umesh.
Thank you, Lydia. By leveraging Microsoft Cloud for Healthcare and the development of industry IP like connectors, data models, workflows, analytics, other solution functionality through our intelligent data platform, we have now created a platform for our partners and customers to quickly innovate across a variety of clinical scenarios and at a lower cost. A great example of unleashing value is through our partnership with Teladoc Health and how they are extending Microsoft Cloud for Healthcare to improve virtual care for patients and drive more efficiency for clinicians. Let me now turn it over to Scott Wilson from Teladoc Health to tell you more. Over to you, Scott.
Thanks, Umesh. I'm Scott Wilson with Teladoc Health. I'd like to spend a couple of moments just telling you about what we've been doing with Microsoft and combining our solo virtual care platform with Microsoft Teams. You've already heard how staff shortages and clinician burnout is making it really difficult for hospitals and health systems to deliver the high quality care that their clinicians want to deliver and that their patients expect and deserve. Solo's virtual care platform allows us to connect patients with their care teams inside the hospital and inpatient and emergent settings, outside the hospital and ambulatory settings, and also direct to patients on their own device wherever the patients and clinicians need to be. Combining that with Microsoft Teams really gives us the ability to turbocharge that virtual care experience for the care teams and take advantage of the world-leading collaboration tools and capabilities that are built into Teams, merging those with the world-leading virtual care capabilities of the Solo platform. So if you have just a couple of moments, I'd love to give you a demonstration and show you what we've built.
The view I'm on right now is our services page. These are all the clinical services that you could configure inside this practice for Solo inside of Microsoft Teams. I've clicked on the All Points Family Health. This is a primary care practice I've got set up. I'm going to search for patient Bernie Wilson. This information could come from the EMR, so all your patients could be here, or you could type it in individually if this was a standalone version. I have pulled Bernie out of the database because I've used him before. I'm going to see Bernie on his own device. I'm going to schedule this for me, leave the date and times the same. If Bernie was a foreign language speaker, so if English wasn't his first language, maybe it's Spanish, I could choose that and I could have an interpreter join right at the beginning of the session. I'm not going to have the interpreter join. I'm going to choose allergies, some sinus trouble, maybe a headache for Bernie, and I'm going to go ahead and confirm the visit. Solo will automatically send out a text message to Bernie. If you watch the cell phone on the left, you can see that the text message just popped up there. This is a secure message that has a single-use link in it that will link Bernie directly to his visit. I click the link. I go into the web app for the Solo patient intake. In this case, I have a consent form that I have Bernie signing here, but I could have any number of different things on the intake screen that I can capture for the visit. Bernie's dumped into a waiting session, and on the right-hand side for the clinician, you can see Bernie's row has gone to waiting. Click on his row. I can review all kinds of information that I could have imported from the EMR into Solo, or things that came from the intake process, like the consent form that Bernie just signed. I could also start a clinical note from here or search imaging such as MRIs, X-rays, or anything else that I have access to through the system that comes from the EMR and PACS systems. When I'm ready to go, I click the Connect button. And for the clinician view, a full version of Teams, if they're using Teams on the desktop, will open up. I click the Join Session, and on the left-hand side in the cell phone, Bernie has been passed off into an ACS-based app for his video part of the session. He clicks Join, and he will be joined into the call. So within just a few moments, both parties are joined into the call. Inside the Teams window, I also have a new icon for Solo that I can click, and I can review all of the information that I had in the EMR for Bernie. I'm going to go ahead and end this session. I want to show you one other fantastic piece of functionality inside of Solo. One of the benefits of being inside Teams is that I can do all the fantastic collaboration things that Teams allows me to do with the rest of my healthcare team, saving all kinds of time and effort and really making things flow a lot faster for the clinicians. So I'm in the team, and maybe this is a person out on the floor. They need help from a physician. There's maybe a camera mounted in the room. So I can come in here and I can type, "Hey, Dr. Wilson, I have a patient. I need some help." I can submit that. Dr. Wilson's going to get that on his phone. It's going to buzz him, whether it's his phone, his desktop, web, whatever it happens to be. And then he can click into Solo on that device and go to the Care Locations tab. This is where all of the devices that we have hooked up to the system in that particular health system will come into play. Then I can click on this one, a demo Light 4 with a boom. This is in a mock hospital we have out in Santa Barbara, California. And within a few moments, I will be connected to that camera, looking at that patient and helping out with the care that that patient and the rest of the care team needs, all without spending the time to walk down the hall or walk to another building and go up to that particular office or patient room where I need to go. So these are just a couple of the things that the Solo and Teams, bringing those together, just really, we feel, supercharges the virtual care environment for clinical care teams and patients as well.
So that's just a quick peek at some of the fantastic things that the Solo virtual care platform can do built into Microsoft Teams. Thanks for watching.
Thank you, Lydia, Scott, and Umesh. We hope you enjoyed today's session and learned more about the value that comes from Microsoft Cloud for Healthcare. Together with Nuance, no other cloud offers best-in-class products, but also best-in-suite solutions across the entire tech stack. Microsoft Cloud for Healthcare enables that unified predictive approach. You have modularity to make it fully customizable and configurable to your organization's unique environments and business processes. The interoperability that helps unify your data from across your organization. The agility to create full visibility into your data supported by AI analyses enables you to have new unforeseen use cases and insights. And extensibility with one of the largest healthcare partner ecosystems to help you innovate faster and make it easier to adapt and grow specific to your company's needs. And it's time for next steps. Join us at our Ask the Expert session on October 12th, where we will deep dive even more with Nuance Healthcare Solutions, and our friends from Teladoc will join us to answer your questions. Or if you're in person at Ignite in Seattle, come by the Expert Zone on October 12th, where Microsoft technical experts will be there to answer your questions. I can also say you should test drive the Microsoft Cloud for Healthcare trial and see it in action. You can contact your account manager or your partner relationship manager to learn more. And finally, just explore the Microsoft Cloud for Healthcare at aka.ms/cloud for healthcare. Thank you so much for joining us and enjoy your day.